This is the Second Chance at Health podcast. I'm your host, Dr. Brad Hassig. Come join me as we remove confusion from the hottest health topics by discussing the latest research, along with what we've seen with thousands of our patients and amongst our community, family, friends, and people all over the nation and world. Let's dig in. Hey, this is Dr. Brad Hassig with the Second Chance at Health podcast. I'm very excited today. This is the 13th episode. This is the first interview that I'm doing. I specifically wanted this person to interview. I have with me Dr. Jennifer Doobrow, a close personal friend and an amazing periodontist. One of the things that prompted this was we've had some great discussions. We've been friends for a long time, husbands, wives, we're all great friends. We've had some great conversations about health and overall health. As a chiropractor, I love the connection between the nervous system and how the body functions. Same thing with Dr. Jennifer in terms of the gums and how cardio and some of that. So we've had some great conversations, and I said, I got to have her on. This is going to be my first interview. You'll see as she begins to talk, not only she's beautiful, she's smart, very accomplished in her profession and very passionate about what she does. So just going to give a quick little bit of background here. We've known each other for over 20 years. We were the in spin class together, and we were the I guess maybe engaged. I don't even know if we were all married yet, but yeah, so we were in there finishing up school, either newly married or almost to be married, so it's children, starting our careers, all this. So we've been through a lot. So I was super excited to have this. So Jen, if you'll do me a favor, just go through, give me your background, some of your professional background, some of your practice background, and what led you to specialized in periodontics.
I'm so excited to be with you. And when you told me that this was the first interview you've done, I'm like, oh, we are going to just knock this out of the park and have a lot of fun. So
that's right.
Thank you, Brad. And I'm smiling because I literally just left your amazing wife, Dr. Lori, so she could adjust me, because these past 3 weeks, I was not smiling. So thank you for all that you two do, because if it wasn't for y'all, I would not be able to function each and every day. And that is the truth.
Thank you.
You are true godsends, lifesavers. Thank you for everything. Oh my goodness.
Awesome. Thank you.
Yes. Well, It is. Yeah, no, it's been a blessing. I mean, I love how you started it off. We talked about this when we first met, and I'm like thinking back to when we started. I mean, literally, Dr. Lori and I were the ones that were pregnant, and people were looking at us like, what are y'all doing as you're riding these bikes? And we're like, it's all about health and body and wellness, right?
That's right.
Yeah, so that was our first introduction. But so me, who I am, I mean, I've always known health and well-being for our colleagues, our friends, our families. I've been raised in a wellness home. My mom has always been in dentistry. She started as a dental assistant, and then about 40 years ago started into dental supplies. So she's been helping the dental community for, I don't want to age her. She'll get mad at me. That which ages me.
That's
too.
right. Keep mama happy.
Yeah, keep mama happy. And then my father was a practicing periodontist for over 35 years. He had 2 locations in Alabama, and so periodontal residency. So the way that it works is you do undergrad, right? So we may talk about it if you can't tell already. I was a cheerleader, not just for this profession, but I cheered at the University of Georgia. Go Dogs! Go Dogs! Sorry.
Woo!
No, you're not a dog fan.
It's all right. But it's red. That works. Indiana, Georgia, I can deal with that.
We haven't played each other too much, so we're good.
That's right.
Yep. So it's the track for dental school is 4 years of undergrad college, right? 4 years of dental school. And then for what I did, it's called periodontics, as you mentioned. And that's a 3-year surgical specialty. So specifically bone, gum health and surgery surrounded by that. But also to place dental implants, which is when somebody's missing a tooth, to replace it with a titanium root. And some do zirconium roots now. And then as a general dentist or a prosthodontist or a restorative cosmetic doctor, they'll build the housing on top. So I always say that we do the cuts and everyone else gets to do the glory, right? We get to do these. So that's kind of a little bit
That's
about
awesome.
the path to get here. So I mentioned it's a 3-year residency, and during my first and second year, my 3 years, my dad suddenly passed away, and so we are so blessed
Sorry.
to be in the best profession. Thank you, because being in Alabama, you have to be a dentist to own a practice, and by the grace of God, I was doing my residency at UAB, and
Wow.
my
What a
faculty,
blessing. Yeah.
blessing, and my faculty at UAB was amazing because they allowed me to do the residency and then go to Jasper, where one of our locations was, and Coleman, which is where our sole and location is now. So it was just a blessing to be in the state and a blessing to
Yeah.
continue its legacy as we're making it our own. So that's kind of in a nutshell, from the 30
Wow.
background. Yeah.
That's awesome. See, I love this because I know a lot, and I mean, how many conversations, how many hours we've probably talked about different things, and I didn't know all that. So thank you for sharing that. That's amazing. And I love, that's with, having just lost my dad, I know how hard that is. So, my heart goes out to you on that. And to do that as a student in the business, and you add all that in there, I knew you were tough, but that just adds a whole nother layer to it. That's even more impressive. So that's awesome. All right. Well, will you now keep this real basic? You're talking to me, so keep it on a 4th grade level. What is periodontal disease? What are some of the main causes, and how common is it, and who's most at risk?
Wonderful. I mean, listen, you're right in my wheelhouse right now. So, and actually I love this because this is my first opportunity to do a podcast with somebody that's not specifically in the dental community. And this just shows, I mean, this is truly, so there's 2 different things, right? So there's interdisciplinary, which we do within our discipline. So as a specialist, as a periodontist, I'm working with a prosthodontist that does big crown cases. I'm working with an endodontist that may do your root canals. I'm working with an orthodontist that does braces and liners and all that. But now this is considered multidisciplinary. And this is what you and I have talked about, right?
Yep.
And our medical and dental fields need to do more of this. I mean, how exciting is this? Like, I hope do this at, not necessarily quarterly, right? Because I don't want to be like boring anybody. But even if we do it like twice a year.
Never. Yes. Hey, you're always invited. I'm throwing that out. You got the open invite. You're in.
Well, you're awesome. I love it. I want to come back all the time. But so multidisciplinary, right? So you and I talk about this so often that it's whole body wellness, right? And we always say what we do with our patients is we always say the mouth is the window to the body. It's kind of crazy. I mean, the best scenario I can give you is this. It's an example, and I love using this. I use this with our patients all the time. I've had the great fortune to speak all over the world now. I speak internationally, and I use this example all over. My dad, God rest his soul, I know, hopefully he's smiling down as I use this as an example. We still have a patient that comes in all the time. Every 6 months, you need to go to if you're going to the dentist, go every 6 months. If you've been to a periodontist, you're going to be going between your dentist and the periodontist every 3 months. So you're actually getting 4 cleanings a year rather than 2 cleanings a year. But this was an incredible young woman that came to us, and I see a frozen. Can you see me? Now you're back.
I can see you. There we go. Yeah.
So she comes in every time I see her, and she says, your dad did. And then I stop and I pause because I know what she's about to say. And she says, listen, Dr. Doobrow, your dad, Dr. Hirsch, I was having so many problems getting pregnant. She's like, this was years ago. This was 30 plus years ago now. She's like, this was before in vitro was a big thing and all the things that people are doing, right? And she said, I came to your dad one appointment and he goes, you're pregnant. Now,
wow.
Do that. I would never do that now. But the reason he even brought that up is because her gums, her gingiva, right? In my world, we call it gingiva. We call ourselves gum gardeners. Some people refer to that. You may have heard of us like diarrhea, gum disease, old school thought.
Love it.
Because the gums show so much, he saw a totally different presentation. Now, he went out on a whim. I don't think I would ever to this day say that. That was 30 years ago. But she goes, Dr. Hirsch, you never knew that I had struggles. She went home, and by God, she took a pregnancy test, and she was pregnant.
Wow.
Yep.
Wow.
Yep.
That's amazing.
And so the reason I tell you that, Dr. Brad, is because what we do as periodontists And what we do with oral health and the relationship with systemic health or overall body health is we know that the mouth is absolutely correlated with the body, right?
Yep.
So when I
Yep.
tell our patients, Dr. Brad, have you been where you go to the dentist and they'll do this evaluation and they call out these numbers and you're like, what are these numbers? Have you heard the numbers?
Yes. Clueless. Yeah. It means nothing.
Right?
Yeah.
What does that mean? Right? So what that means is when they're checking the numbers, they use this, we call it a dental ruler. Okay. It looks a little
Okay.
scary. It's not scary. It's not going to be pokey, maybe just a little.
Okay. I was going to say, yeah, as long as it's not, yeah, that's okay.
But they'll use this dental ruler, dental GPS, and they do these measurements. Okay. What the measurements are, we'll always say the lower the numbers. Like if you hear 3s, 2s, and 1s, Dr. Brad, you're hearing healthy numbers. But if you hear that are big numbers, okay, using this dental ruler, then that means that there's signs of infection and disease.
Okay. Cool. So, well, see, that's good to know. That's you hear that. And like I said, it's, you get outside of even if you're any sort of doctor or have healthcare knowledge, you get outside of your specialty and you're clueless and you just shut off. Your mind shuts off when you're doing something else, whether you're intimidated, whether you're tired, whatever it is, you don't know. So thank you. That was a great, even I could understand that. So hopefully everyone else listening can. That's great.
Yep. And so the reason that's important based off of your question is what we explain to our patients is this. And you can talk to your patients too, because I mean, inflammation is throughout the body, right? And we can see it in so many presentations. You and I talk about this all the time.
Yep.
I said the higher the numbers, right? We're using that dental ruler. What it is it goes between your gums and your tooth.
Okay.
And so what we're looking for though is inflammation.
Okay.
And the higher the number, the more inflammation, the more bone loss. And why am I talking about that right now is because so many of us are walking around with so many different inflammatory diseases, right?
Right.
Or so many things, right? We may even have a laundry list of medications. We call it the Santa Claus list. And
yes.
Yeah, we kind of think we're healthy, but we got to look at the picture.
Yes.
Yep.
That's awesome. I love that. And so, explain a little, once again, keep it basic for us, that connection between the gums and the heart. And I know one of the things, obviously with, and I'm going to jump right in there. I told you I'd wait a little bit to the end, but with COVID and with the shots and all that stuff that we've seen things change. Yeah. Explain the gum health, heart health, and then any changes that you may have seen. You've been doing this for 20 plus years. Yeah. You've been in practice, right? Okay. So explain the connection, gum health, heart health, but then any changes that you may have seen in the last 3 or 4 years, if you will.
Yeah, absolutely. So every time I speak and I lecture, I always say I'm painting a picture and telling a story. So the reason I told you anything about those numbers is this. So we tell our patients that when we do those numbers that I just told you about, and the higher the numbers, the more the inflammation, the more the disease, right? We know that there's a very strong, I'll never tell you it's going to be causing it, right? What I'm about to say is not going to be causing it. But the higher, the stronger the association with heart attacks, strokes, high blood pressure, cancers, diabetes, even Alzheimer's. And in men, there's other parts of the bodies that can be affected as well. Not sometimes when you only get medicine, okay?
You got it.
Yep. And what I'll tell you is, and especially living in Alabama specifically, we are in that black belt of disease. Right?
Yes.
Trifecta. Obesity is very common. High blood pressure is very common. Diabetes is very common. And so actually diabetes, 1 out of 5 of us are walking around and not knowing that we have diabetes.
Yes.
And people know that, And so I use that example about my dad mentioning about the gums. And the reason being is because somebody can walk in and, believe it or not, we can smell disease. You yourself, Dr. Brad, when people are on the table, you can smell disease. And it starts right there, right?
Yeah. Right.
And so I know that was kind of a long drawn out description.
No, that was great.
That's the reason why,
Well, and that's great. I love, you're doing such a great job of explaining it so I can understand, with this. And I love those connections. And that's what you and I have talked about, and that's what I've seen. I've morphed into, with chiropractic, but then getting into the functional medicine to see things with insulin insulin resistance, you're seeing diabetes, hormone imbalances, thyroid issues, weight challenges, digestive, all these things tie together. And I love we both take from different healthcare professions, but we're taking this overall approach. And I love how you said that where you're not going to have a direct cause and effect. You're going to say, well, this is what caused it. But man, you have to look at that, and you have to accept that there's something going on before you can try and address it. So do you have any favorite studies that you've seen recently? I guess that kind of ties some of that in. Have you seen some changes? And one of the reasons that I ask with that is I don't believe it's been published yet, but I was seeing in the Lancet, and they went through and they were studying people that had passed within 1 week of having the COVID vaccine. And they went in and they did autopsies, and there was a 73.9% correlation that they found between those two, the probability that it was related to that. It hasn't been peer reviewed, published yet, but it's it's in the discussion. I think Peter McCullough was one of the ones that did that. So that's one that I just found fascinating. Are there any right now? I know you speak so much. Is there anything that you found interesting here recently?
Yeah, I mean, you asked a great question earlier, and kind of the segue into this. We are seeing a different level of disease now. I don't want to say kind of, right? It's systemic disease. There's different ways that it is expressed. Same thing with the mouth.
Yep.
But we're seeing different kinds of disease because people, number one, they didn't get out of the house, right?
Yeah.
I mean, and I'll tell you, I mean, and actually, you and I talked about this extensively, that it wasn't necessarily neglect. It was fear. I mean, people didn't want to leave.
Yeah.
They go into certain environments. And then even then it took individuals a while to really get back into their system of what they were used to with their evaluations and everything. So we've seen, oh my goodness, I mean, in the dental world, let me give you an example. We've seen from everything from severely cracked teeth that we never used to see because stress, being inside.
Oh, yeah. Okay.
And for those of you that think going to Walmart or Target, and this is not sponsored by either one, or CVS or whatever, any of those.
Not yet, right?
Not yet. But the reason I say that is please, if you feel like you're grinding or clenching, and Dr. Brad, when I had my adjustment today, I asked Dr. Lori to put, some of the pressure right here because I feel it. I feel that tension.
Yeah.
We all experience that. If you have those tension headaches, get evaluated by your dentist and your chiropractor. Right?
Yes.
All correlated. So we've seen so much increased stress related injuries to the mouth, and then whole body systemic. I mean, we've seen issues with blood pressure that people never thought they had it because they went 2 years without getting checked. Right? Why do they call it the silent killer? Because you don't really have symptoms until it's that severe a lot of the time.
You got it. Yep.
We've seen people with nervous system issues that, whether it was from a medication they took to prevent the disease or whether it was from the disease or virus itself, I don't know if we'll know that or not. We do know, you asked about studies, we do know people that had advanced periodontal disease actually were hospitalized more frequently, were ventilated more frequently on ventilators with COVID-19 than individuals that were not. So the correlation of severe disease in the mouth correlated with higher incidences of being in ICU, ventilation, and unfortunately death outcomes as well.
Wow. And so from what I'm hearing from you is that you're seeing that correlation, the inflammation, gum inflammation, that stuff, that there would at least be some sort of correlation with heart inflammation, heart disease, some of that. Is that what I'm hearing?
Yeah. I mean, we have actually seen in studies, and this is just, I mean, the most beautiful thing for me, a biggest blessing about lecturing is you have to be relevant, right? You have to stay relevant.
You got it.
I'm constantly learning. I'm constantly attending my own, somebody else's CEs to stay on top of it, right?
Right.
The conversations like you and I are, but the most profound part about that is what keeps coming out, right? And the knowledge that we glean from that. And so, the most important thing I can tell everyone on this podcast is be your best advocate, because constantly learning. You know your body the best, right?
You got it.
And unless
Amen.
unless you express the issues that you're having with Dr. Brad or our practice, and we're called Periodontal and Implant Associates. So we do whole body wellness to replacement of teeth, right? But we tell our patients when they come in, if you're our patient, Dr. Brad, we're going to say, Dr. Brad, we firmly believe that God gave us our teeth for a reason. So we're going to do whatever we can to help you hold on to them, because a replacement is never going to be the same.
Right.
But
I love that.
Yeah, be your best advocate, whether it's from mouth, whether it's body or what have you. You gotta be in tune with it, and you gotta know what's going on. Because if not, it could be brewing and you have no idea, you know?
You got it. You got it. I love that. Well, and I love one thing that you touched on with that too is, you know, and this isn't, you know, to bang on shots or response or anything like that. I think you and I are both, any good scientist is just going to be interested. You know, what's going on? Why is it going on? And what can we do to try and help with this? And the stress part that you saw, people were stuck in fight or flight. You know, I love when patients will come into us and they'll say, you know, Dr. Brad, Dr. Lori, have you ever heard of this dysautonomia? And I just smile and I think that's literally what our profession was based on. You know, that's the fight or flight, wine and dine coming out of it. And so many people were stuck in that. And as you said, one of the ways that it was manifested, you'd see TMJ issues, you know, TMD. And I can't imagine, you know, the amount of stress. I'm sure people were cracking their teeth because they were clenching so hard. They didn't know how, nobody knew how to deal with that stress and that fear that we were feeling. So I find that absolutely fascinating that, you know, to see your correlations. We saw how the ways that we would measure it with the nervous system, and things were just blown out. You could see the area of the fight or flight where it was just things we'd never seen before, or maybe you see rarely. So is that something you saw a lot more of those things during that time and hereafter as well?
Yeah, absolutely. I mean, some crazy things that we started hearing were younger individuals that would never have presented before that had like spontaneous bleeding, right? Like, so something was changed in our whole body system. Whether it was, you mentioned, you know, whether it was the medication we put in our body, as I said, whether it was the virus, whether there was a combination, but also, as our population ages, we're going to have more and more diseases and viruses and allergies. I mean, you and I have talked about this before. We need to know what's going in our body, right? Our body's processing things so differently, even medications. I mean, we have gone to much more of a homeopathic perspective. I mean, I love it because you and I are so on the same wavelength when we talk about this. I mean, there's certain medications I have to use, and I'm not knocking pharmaceuticals. I don't mean that. But because our body is processing things at such a different pace now, our gut flora has changed over the years, whether it's the foods that we're eating or the ways that we're processing it. So we're just having, the pendulum has swung. That's it. Yeah. And it continues to, you know? Yes. I love this. Like, I'm sitting here with the chills. I'm so excited that we're having this conversation, because this needs to truly be the first of so many conversations for our dental medical professionals, for all of our patients that are listening right now. You know, I mean, I hope you and I can refer. I've referred a ton of patients, even though I live in Birmingham and our practice is in Coleman, and I've referred a ton of patients to you guys because of that, right? Because there is a whole body wellness portion of this. I'm like getting all tied up because it's like, that's how excited I am and passionate about it.
Well, I love your passion. I love that you touched on the gut flora too, because once again, that's one of the things that we see you know, we've seen it on the chiropractic side to a large degree, but it is just off the charts with the functional medicine, what we're seeing when we're doing lab testing, and we're seeing that, and that so many people tie it just to malabsorption, hormone issues, and that stuff, and it definitely does. But you're also seeing the cognitive and the emotional effect. You're seeing a lot of the stress, PTSD, and people had PTSD after the stress of COVID and being locked down and all of those things. So it's amazing. I love that you tied in with the gut connection. You know, we talk about it, the brain, gut, teeth, heart, all of that ties together. So tell me this, what are some, you know, we've spoken truth and maybe scared folks a little bit with this, which is good. We'll say woken them up a little bit. give me some practical things. What can people do from your end to try and have the healthiest gums, the healthiest and lifestyle stuff? So give me your best nuggets.
Oh, I love it. You're asking a periodontist what to do with oral health. It's awesome. And just so I can make sure that everyone understands, right? So a periodontist, and I cannot stress it enough. So periodontist basically does the gum and the bone treatment, right? So we call it building the foundation and helping you maintain the foundation, because all of these pearly white things that you hope you have are straight or not straight, whatever it is, you've got to have the foundation underneath, right? But the reason everything, Dr. Brad, you and I are talking about is because within that foundation, there are nerves, right? And there's blood supply, and then there's vessels that will all track down. And that's why it's all upper and lower related, right?
Gotcha.
And so it's so important to understand that, because everything you put in, something's going to occur. You know, it's either the run joke is like, it's going to put it in, it's going to come out, but how's that going to transpire? And so what you have to understand is, you know, it all starts with bacteria, but it also starts with how your body responds. So for instance, if I have no health issues, okay, and you have a patient A comes in, or John comes in, and he's got diabetes, and he's got high blood pressure, and he's got stress, and he's got that, his body's going to respond so differently, okay?
Okay.
That's why it's important to understand what you're bringing to the table. We know, for instance, to give you an idea, the more inflammation and infection you have in the mouth, so diabetes, we're going to bring it up again, diabetes is the one body disease that we know is actually correlated, causative, and vice versa with the mouth. So it's like a swinging door. It's called bidirection. All right.
Okay.
What that means is if you have more inflammation in the mouth, that your sugar control is going to potentially be worse. And if your sugar control is bad, your glucose control is bad, your A1C, for those of you that are diabetic, is high, right? Over 8, over 9, over 10, that your inflammation in the mouth is going to be worse.
Okay.
So
interesting.
That's number one, because, you know, if you look at the numbers, there's over 25, million Americans now growing every day that have diabetes. And then we said 1 out of 5 Americans don't even know it.
Right.
Walking around. I mean, I was in your office today, and there were probably 8 people that were in there, because you guys are so efficient at the same time. So that's one thing. So if you have health concerns or maybe you think you have health concerns, that's a message. Number 2, brush your teeth. Right?
Yes.
Side of your toothbrush, and if and those little things are flaring out, change your toothbrush head. Okay,
you're worth it. You're worth a toothbrush. Go get yourself a new one. Yeah. Yes.
And I say change your toothbrush head because we actually recommend electronic toothbrushes over manual toothbrushes.
Yes, that was gonna be one of my questions. That, and then to get into, obviously, with flossing, and I've got the Sonicare, and I'm trying to think of which one it is that has like the water pick in the toothbrush. You know, I'll have people, well, I don't have to floss because I use my water pick, and I don't guess, I am kind of OCD, so I'm gonna brush, I'm going to floss, and I'm going to water pick. So what are your thoughts on all that? Does one replace the other? Is one better than the other, or is it hit it as many ways as you can?
First off, you're hitting hard to the heart. I love this. You said we get like 20 or 30 minutes. I want like 2 hours, but nobody wants to do it.
Love it.
Electric toothbrush, right? The greatest thing about electric toothbrushes are that they have timers. And, you know, like your whole life, you've heard like, do it 2 minutes, da-da-da. Well, who's sitting there watching their watch, right, to do that?
Right.
But they actually smart. Like they have smart technology. Everything's about smart. It's connected to your phone, right? Here's my family.
Nice. Yay.
So 2 minutes twice a day, at least 2 minutes twice a day. Okay. And then with flossing, throw those picks out. You know, the like pick on a stick, we call them.
Yeah.
Throw them out. Okay.
Okay.
It's not doing well for anybody, because what happens is you're taking that same piece of floss on that little pick on a stick, and you're taking underwater. It's not doing anything. That bacteria is already on there. So all you taking the same piece of floss to each spot with the same bacteria in each spot.
Okay, interesting. You just ramming the bacteria around to different places.
Yeah, that pick on your table right now that I see. No, I'm just kidding. You throw it out.
Uh-oh.
So the string floss, everyone, that's what we want to recommend.
Okay.
And, you know, you're going to have enough. Just move it around so you have the new piece where it's not the same piece going in and out. You got to get
Okay.
down. It's going in and out, right? You got to go in. You really get down. You go C shape. I mean, I'm giving you some oral hygiene. Like my hygienist will be so
Love
proud.
it. I love it.
And do that at least one time a day.
Okay. Okay. Awesome. Awesome. Well, I guess, man, this is great. We've hit on so many things with this, and that's what I wanted, that practical. What are some takeaways that people, anything the reason for me to do this, the reason for me to have amazing guests like you on is to give people practical information so they can be as healthy as they can possibly be with this. So I guess, what new things do you see on the horizon in your profession? What things are coming up? Because I know you're in the middle of it. You're a great person to ask about this. You're a renowned international speaker. What things in the next 5 to 10 years do you see in your profession that are going to be impacting health overall for everyone?
Oh, I love it. I just love this question. So I'm going to answer that kind of a historical perspective, right? So many of us went to the dentist years ago. I'm going to age myself again. And it was like that old x-ray machine, and it clicked and it clacked, and you had to bite down on stuff, and you're like, I'm broken, right?
Yes. Oh.
So, yeah. And then Dr. Brad, you guys probably had to do this too. Then you had to process the film.
Yes.
Wait, or you had to wait.
Sniffing fumes in a tight, dark little room with a red light. Yeah. Oh.
Like PTSD. There you go. Right.
Yes.
You have like stains on your fingers. So,
right.
So those of you that are old like me, remember that. Hopefully many of you are young and don't remember that. But so where we've come, right? So that was 2D x-rays, and that was film. So now we have 2D x-rays that are digital. Like when I had my wellness check, you guys did digital. Yeah. And now a lot of us as a surgeon, we have 3D. So think about it. Yeah. So think about it in a perspective like this. For the women on this call, I can tell you, I will always get a 3D mammogram. Like it's just my thing. Like I want to be able to see things in 3D because I know how inclusive that information is. So we're seeing pendulum swing, right? I mean, I saw it in your office. I think when I first started, it wasn't as digital with you. We've been working together for so long. Now everyone's like, So you got it. Yep. I say that now because even now AI is coming into dentistry.
Nice. How is that being utilized?
So really it's kind of that like beginning, right? The forefront. It's just now, but you're going to eventually go to the dentist and they're going to be able to see a cavity that the AI is going to be able to identify the cavity. So there's no you don't. So it's a double, triple check. So the AI is going to detect. And then us as a dentist, now I'm not the type of dentist that does fillings or crowns or that kind of stuff because I do the surgical stuff you said. I also, like for us, I mentioned the bone and the implants. We also do, if you've heard of recession, right? Periodontal recession is recession of the gum and the bone. So when you have roots showing, that's another thing that we do. So all of that is going to be digital. Like I can take a picture of your mouth, Brad, put it on a screen, and I'm going to be able to show you that after I do my treatment, this is where we anticipate the gums to end up. Like it's just crazy. Oh,
wow. That's amazing. Well, it's funny because that's what I'll tell patients, with x-rays, and I'll say, look, this is a 2-dimensional view of a 3-dimensional object, which is you. And so some of the stuff, even though, a lot of times we're taking perpendicular, a front and a side view to try and so, but you're still theorizing certain things. So that's amazing. And then to add in, to have that technology with AI, that's, I mean, and you've got to be on it. You've got to be on the cutting edge of this stuff so that, and I know you feel the same way, you give your patients the best you can possibly give by staying up with the technology. So that's amazing. That's amazing. Awesome. Well, hey, what other kind of closing thoughts, any, kind of last takeaways? I'm going to leave it to you on that. Tell me what you would want to leave patients with. Yeah, no, I love it. The bottom line is you got to own your disease. If I had to own, it was really hard for me to know that to do this all day long and be able to do surgery. I couldn't do that the way that I was feeling because my back was in just so much pain.
and no medicine, no massage. Like that wasn't going to cut it. Like I had to go to you, and I'll never forget the day. And I mean, that was back in 2018. And I mean, I'm in tears because I thought I wasn't, my back was in such bad shape. Right. And you broke it down for me. Like, listen, this is what we need to do. But I had to own it and not be in denial. And just say, if I want to move forward and be the best that I can be for my patients and my team and my dental community in the state of Alabama, I have to own that I've got something that needs to be taken care of. And so, and you've helped me. And I mean, you've helped so many. I mean, I'm in there and I see other fellow surgeons, oral surgeons with me, So own your disease. If you have a diagnosis of diabetes, don't scare away from it. Figure out what you need to do, learn the nutritional, secrets, if you will, or information that you need to know. It's not all about necessarily the medication you're going to do. If you feel like there's a weight issue, just by taking a medication, you got to do other things, right? You got to figure out what's going to work for you for wellness. Start out by walking. You may not be able to go run a marathon, but figure out what's going to work for you.
I love that.
Yeah.
I love that.
And that's one thing I can tell you too. And Dr. Brad, I'm going to use this as an example that we use with our kids, right? Like if I tell Hampton, our 14-year-old son, I'm a little mad at you because your room is dirty. I mean, he's not going to care to go clean his room,
Right.
So you say to Dr. Lori, "Oh, I'm a little hungry," and you guys have other ideas. Well, you're not going to get dinner right away.
I love how you're saying this. I can picture you saying this to Todd right now. I'm a little hungry.
Right?
You're getting nothing, Todd.
Right. But what happens is we all minimize everything because it's hard to have those conversations, right? Sometimes.
You got it.
So don't minimize what's going on in your life. Don't minimize what's going on in your family members. Like, let's help them own it because all you're going to be able to do is help them along the way and help yourself along the way. And
I
be
love
the best. That's really, life is short. Life is
got it. Oh, I love that. Well, and that's the thing when you're telling, whether it's your family, but when you're speaking to patients, you're speaking that truth of, look, God made you for a reason and loves you and wants you to do well. And it's so easy for us oftentimes to take better care of others. Do you find that to be true than what we do ourselves? And it's like, you've got to take care of yourself to be able to take care of others, and whatever talents, abilities, profession God's blessed you with. If you want to be able to do that and fulfill your goal and your servant's heart, you've got to take care of yourself and take care of your health. So I love that. Well, thank you so much for giving me. This has been amazing. I knew it would be great. It's been even better and more fun than what we even expected. So thank you, Dr. Jen, for this. We're definitely going to be doing this again. Everyone, it's as always, I appreciate people tuning in. Please subscribe. Please share this with others. If you've got other ideas, different topics, things that you want us to talk about, please feel free to leave comments or reach out to us. Dr. Jen, real quick, tell if anyone's got any questions for you, if anyone would like to use your services, how can people reach you?
Yeah, thank you so much for that. And I hope we do, right? I hope, if anything, just come in and see us, even if it happens to be an initial evaluation to tell you everything is doing great and you're doing great. It's always a good thing to have that evaluation when we're talking about whole body wellness. So we are in Coleman. Like I said, our practice is Periodontal and Implant Associates. And we are straight up 65 if you're in Birmingham. It's a blessing to do that. We're straight down 65 from Huntsville, and we are here to help. We're here for if you feel like you are having bleeding gums, or if you're starting to have sensitivity, or if you're missing a tooth, or if you know that you're going to have to lose a tooth. That's what we're here for. Anything that we can do, and I'll leave you with all my information, Dr. Brad. But just look us. Yep, we're on social media. We're Coleman at Coleman Perio, CULLMAN PERIO. So Coleman Perio is on Instagram. Come and find us. And I'm just going to leave you their number just in case anybody wants to write anything down. Our office number is 256-734-8588. And it's just, like I said, I drive in from Birmingham every day. So if you're coming, we've got patients, Dr. Brad, that come from all over the country.
I don't doubt that. I don't doubt that. And people, just so you know, whether you're watching on YouTube or you're listening, this energy, this passion that you're seeing from her, this is genuine. This is all the time. She's like this all the time. This is genuine. It's a genuine passion. So it would absolutely be worth whatever drive to have. You've heard her describe this. This is the kind of care you would receive. So I want to support not just my friends, but people that love what they do and have a mission to take care of others and help them be as healthy as possible. So awesome. Well, thank you, Dr. Jen. I really enjoyed this. Like I said, this will be the first of many. We'll figure out doing this. I'll do my best to try and still working through technology, but I'll do my best to try and leave your information even below. If anyone has any questions, contact me and I can get you in touch with Dr. Jen. So everyone, thank you for listening. Take care and stay healthy.